This is CGTN, China Global Television Network.
With more African countries reporting confirmed cases of the coronavirus, governments announce a raft of measures to curb the virus spread. On the international scene, a social and economic crisis unfolds across Europe due to the pandemic. More than 20 countries asked the IMF for emergency aid as the coronavirus wreaks havoc on markets. We give you the latest on the COVID-19 pandemic. Hello and welcome to CGTN. This is Africa Live and I'm Karen Robnerts in Nairobi. Also coming up in the programme. In business, Nigeria's central bank will create a $163 million fund to combat the impact of the coronavirus pandemic. And in sports, Caster Semenya comes 0.32 seconds short of qualifying for the women's 200-metre race at the Tokyo 2020 Olympics. In Africa, over half of the countries on the continent have now reported confirmed cases of the coronavirus. Let's break down the numbers by region. North Africa has the highest number of cases, with the majority in Egypt. 2 more deaths have been reported in the country, bringing the total to 4. The individuals are a 72-year-old German and a 50-year-old Egyptian. East Africa has a total of 22 infections. Rwanda has the highest number in the region, but moving swiftly to contain its spread, the nation closed schools and places of worship after its index case. In West Africa, confirmed cases have gone up slightly, with 60 reported across the region. Senegal's national carrier has suspended a number of flights to curb the spread of COVID-19. Central Africa has the lowest recorded number of overall cases at 12. The Democratic Republic of Congo has just announced its 4th case. Meanwhile, in France, the first DRC citizen infected by the coronavirus died yesterday. And South Africa's president has declared a national state of disaster after the country continues to have the 2nd highest number of cases on the continent. Well, as coronavirus numbers across Africa continue to slowly rise, countries have put in place stringent measures to counter the spread of COVID-19. In South Africa, President Cyril Ramaphosa has declared a national state of disaster, while the Ethiopian government has banned all public gatherings for 15 days. Despite recording no cases, Zimbabwe too is beefing up its already strained health sector to deal with any cases there, should they arise. Let's now take a look at some of these measures from our correspondents across Africa.
Since the first reported positive case, the infection rate has doubled every second day, and this prompted the government to step in. The health minister, who's been driving the fight since the beginning, is now focused on containing the virus.
What we want to do is to contain it such that it doesn't give an explosion that overwhelms the health services. That is what this is all about, and therefore community mobilization and getting community to participate is important.
The finance ministry is responsible for finding the funding to tackle and control the pandemic in South Africa. There's a structural arrangement in place between the departments of finance and health to communicate and assist the national and regional departments.
There are funds available within the National Disaster Fund, which will be immediately available. I don't want to mention amounts in case prices begin to change, but funds have been set aside. That's the first thing. Secondly, as the situation develops, we will need to set aside further funding. That means we'll have to reduce programs throughout the government system.
Part of the announcement by President Ramaphosa was that the visas for people traveling from high-risk countries were immediately cancelled. The reality is that the South African education system hosts several thousand foreign students who all have current visas.
So I don't think
the issue of visas for people who are already studying will be affected in any way, except if the person wants to go home, depending on which country they are going to. Then the normal measures which you have mentioned here will start kicking in.
The declaration of a state of disaster requires legislative changes. It's appeared in the country's government gazette, but to give force to the new powers, new regulations are required by law.
The first priority now, which we started last night, was to do the regulations that will guide this national disaster. And I can say that those will be ready today.
Minister Mboweni made the point about keeping the economy going, and this was reinforced by the announcement that the mining, manufacturing and retail sectors would remain open for business, with stricter hygiene measures in place. It was a 3-hour-long marathon period in which some 17 ministers were on hand to answer all the questions that the media posed. But it is day one of this National Command Centre. We'll have to see how the government coordinates everything. I'm Angela, CGTN in Tshwane, South Africa.
Ethiopia's Public Health Institute has confirmed there are now 5 coronavirus cases in the country. Ethiopia's first confirmed COVID-19 virus patient was a 48-year-old Japanese who arrived in the country from Burkina Faso. Now, Prime Minister Abiy Ahmed has announced all schools will be closed, all public gatherings, including large sporting events, will be banned for 15 days. The government has advised people to remain in high alert.
We want people not to panic because of the disease, but at the same time, we want our citizens as well as everyone who lives in this country to remain alert and never underestimate it. People are advised to seriously follow and practice all the decisions made by authorities in line with the attempt to curb the effects of the coronavirus. We have to get used to these new ways of life until all is behind us.
Hundreds are assumed to be under a serious quarantine in the country. The Ministry of Health said those with the virus are in a stable situation with no underlying symptoms so far. The minister, Leah Tadessa, says preparations are continuing for any drastic increase of COVID-19 cases.
We are strengthening all aspects of fighting the virus's spread here. That includes providing ample information for people, quick laboratory service provision for any suspected cases and more. These are being done on a daily basis. Isolation centers and works of quarantine are being reinforced as well. We have a hospital at the moment which exclusively handles the COVID-19 disease cases.
Citizens are advised to avoid handshakes, wash their hands and practice social distancing to avoid catching the coronavirus. Despite the government advice not to panic, people are busy of emptying supermarkets and shops. On the other hand, authorities are blaming and taking measures against some merchants for their unnecessary price rise and hoarding. Grumtala CGTN, Addis Ababa, Ethiopia.
Meanwhile, Egypt has announced a complete suspension of flights to and from all destinations starting on Thursday. Well, earlier the government announced that it had shut down schools and universities for 2 weeks. Here's Adel El Makhrouhi with more.
Egypt is going on a total international lockdown. Egyptian Prime Minister Mustafa Madbouli has announced on Monday that all flights will be suspended starting March 19 until March 31.
These are precautionary measures that guarantee the prevention of the disease from spreading, as we've seen it happening in a number of countries in the world.
Tourists already in Egypt will be exempted from the flight suspension. They will be allowed to complete their program and leave the country according to the schedule of their original plan.
The losses of the airports and the airlines during this period is estimated to be $160 million US. Egypt's government, however, cares more about the well-being of its people, more than these losses.
The government says it will also be decreasing the number of employees working in the public sector. Schools and universities across Egypt will be shut down during the coming 2 weeks. Adel Mahroui, CGTN, Cairo.
Egypt's central bank has announced the largest ever rate cut to tackle the coronavirus fallout. The bank cut lending rates by 3% at an emergency meeting. The Monetary Policy Committee reduced the overnight deposit rate by 300 basis points to 9.25% and lending rate to 10.25%. The main operation rate has been cut to 9.75%. The discount rate was also decreased by 300 basis points to 9.75%. The new cuts are the largest since the flotation of the Egyptian pound in November 2016. The decision is expected to boost public, private and enterprise sector companies. The Apex Bank has already given businesses and individuals a 6-month extension of credit payments. The decision is meant to limit the economic impact of the COVID-19 pandemic. And Nigeria's central bank will set up a $163 million fund to combat the impact of the coronavirus pandemic. The bank's governor, Godwin Emefiele, said the credit support is intended for loans to pharmaceutical companies planning to expand or establish drug manufacturing plants in Nigeria and health companies intending to build hospitals and clinics. Other measures announced include cutting interest rates on some central bank loans to 5% per annum, down from 9% for 1 year. The Finance Ministry last week said the West African country would cut the size of its record $34.6 billion budget for 2020 due to low oil prices. Africa's top oil producer has been hit hard by low crude prices caused by a price war between Saudi Arabia and Russia. We are going to a short break now. Don't go away. Lots more to come, including a social and economic crisis unfolds across Europe due to COVID-19. We bring you the latest from Brussels.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
The world has seen a dramatic increase in COVID-19 cases. Over 180,000 people have been infected, and the global death toll has surpassed 7,000. Outside China, there are more than 100,000 cases spread among more than 150 countries. Italy has the largest outbreak in Europe, and its death toll surged on Monday to more than 2,100. Spain is Europe's second most affected country, reporting nearly 10,000 cases. Iran, the worst hit country in the Middle East, has granted furloughs to 85,000 prisoners to contain the spread of the virus in prisons. There are around 15,000 infections in the country, but the virus has seen a slowdown in South Korea, which reported 84 new cases on Monday. On the Chinese mainland, 20 out of the 21 new cases were people arriving from abroad. Only one new case was confirmed in the epicenter Wuhan. 85% of patients in China have now recovered. Well, measures to limit the severity of the outbreak in Europe are becoming stricter by the day. Some 100 million EU citizens have been ordered to stay indoors, and internal borders are starting to close. It's raising alarm bells in Brussels. Officials there are growing increasingly concerned over what this could mean for the flow of desperately needed goods. Tony Waterman has more.
This is the new reality in Brussels. empty streets, quiet squares, shuttered shops. Belgium has been a near ghost town since Friday at midnight, when all bars and restaurants were forced to shut their doors for 3 weeks.
It's completely confusing, okay? I know we have to close, but that's it.
Other countries quickly followed suit. Restaurants, cafes, cinemas, schools, and most shops across France, Spain, Ireland, and Austria are now closed. Movement has also been severely restricted. 100 million citizens across Europe are now in lockdown. Borders are also being sealed. Germany shut its borders with France, Austria, and Switzerland on Monday. Denmark, Poland, Norway, and the Czech Republic, to name just a few, have also introduced border controls. It's led to a stark warning from Brussels.
If we do not take action now, shops will start facing difficulties in refilling their stocks of certain products coming from elsewhere in the single market.
The Commission once again appealed for coordination. President Ursula von der Leyen also introduced strict restrictions on the export of protective gear like face masks to non-EU states. Member countries wishing to export such supplies will now need explicit authorization.
A recession is now expected in Europe. The European Commission says that this outbreak could shave 2.5 percentage points off of real GDP. To help soften that blow, individual governments have been unleashing their own aid packages. A challenge now for EU finance ministers, who are having a video conference call on Monday, is how to bring all of these disparate pledges into one solid economic package. Tony Waterman, CGTN, Brussels.
And now we take a look at the worst hit countries in Europe. As we mentioned earlier, Italy has the largest outbreak on the continent, reporting over 27,000 cases. Spain is the second worst hit on the continent, confirming nearly 10,000 cases. The nation is under lockdown to contain the virus. Elsewhere, French President Emmanuel Macron says France is at war as the country confirms over 6,600 cases. Macron announced a nationwide lockdown on Monday. It will start at noon on Tuesday and last for at least 15 days. Germany has reported over 7,000 cases. Most shops and venues have been ordered to shut down, and schools across the country have been closed. Chancellor Angela Merkel has also banned religious services and urged people to cancel foreign holiday travel. Our reporters spread across Europe have filed these reports.
Fewer people out of the city of Rome. If they are, they're wearing masks or they're keeping that safe 1 meter or more distance from themselves and others. Now, if you do venture out, you need to carry a self-declaration form attesting to the fact that you're going out for reasons of work or you have a health reason or other essential activities. Medical experts are saying that Italy has not reached its peak yet. The government on Monday passed a series of measures to help families, workers, the medical sector, as well as industry to deal with this issue. Measures worth some 25 billion euros. Now, in the health sector in particular, they're looking at converting hotels into isolation centers, and they're also looking at factories and pushing factories to produce more masks. All eyes really on that cluster up north and the health system there that is really on the brink, particularly to the intensive care unit.
France is fighting a war now against an invisible enemy, the coronavirus outbreak here, saying that all government reforms are going to be stopped. All focus now for the government will simply be on combating this enemy. People must limit social gatherings. You must limit your contact with other people. You're not going to be allowed to go for a walk in the park or go to meet other people. They're going to be banned. There will be punishments for people who do not abide by the new guidelines. Now, the focus...
Travel. UK Prime Minister Boris Johnson says if you have a fever or new dry cough, you need to isolate yourself at home. And the government says within a few days it will ask people aged over 70 and those suffering from pre-existing health conditions to self-isolate for up to 3 months.
And the UK's response to this virus has become controversial. It's been criticised by the World Health Organization.
Last week, the UK's chief scientific advisor said if 60% of the population became infected, the community would develop herd immunity. It's since backed away from this policy. saying its priority is to reduce infection rates, protect the vulnerable, and prepare the National Health Service before the virus reaches its peak. Boris Johnson warned the public that the number of infected people is accelerating, and it's on track to double every 5 to 6 days. For now, the UK isn't under complete lockdown, but it's getting closer.
The US Department of Defense announced on Monday that 37 cases of COVID-19, including 18 members of the military, have been confirmed. That's up from 10 on Saturday. Hundreds of people in the department have been tested for the virus. The Pentagon also announced that US Defense Secretary Mark Esper has imposed social distancing among his staff and his deputies team. The pandemic has turned life upside down in the United States. Millions of people are now under a partial lockdown, with schools and restaurants closed across several states. We've got all the sports news coming up for you after the break, including Caster Semenya comes 0.32 seconds short of qualifying for the women's 200-metre race at the Tokyo 2020 Olympics.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Africa Live. Find your voice.
Double Olympic 800-metre champion Caster Semenya stormed